One of the things that we found was that diagnostic radiology has been around for 100+ years. And in fact, the very name diagnostic radiology is that it's based on radiation. And so everyone's aware of how that works and how does CT work and how does a chest X-ray work. And they recognize that you're going to take an energy source, you shine the energy source at your patient, and some of the X-ray photons go through and some don't. Some get reflected, absorbed, or deflected. The more of the X-ray photons that strike the receiver behind you, the blacker you're going to show it on the image, and the fewer that strike it, the whiter you're going to paint it on the image. So number one, everyone recognizes is a single energy source that you're probing the tissue with. The more that get absorbed, it changes its color, so to speak, and makes it from black to white. And that's the contrast on the image. We also know that there are some risks associated with this energy source. The predominant one, of course, is carcinogenesis. And so everyone also recognizes if I'm going to take a chest X-ray and I'm irradiating your chest, then that which was irradiated has a potential to be exposed to carcinogenesis. I'm not worried about your foot. I'm worried about your chest if I did a chest X-ray. In fact, it's so clearly understood, it's so mechanical that we don't even think about it. To the point where there are people that would say, like, well, you know, if she's expecting, she's pregnant, can I scan her? Well, scan the head. Well, you know, but there's scatter. And then they've done all these studies and they've shown it's really negligible. Essentially, if you're not irradiating it, it's not a major exposure. And you can go ahead and scan the head because you're not irradiating for any significant volume, any significant amount. You're not irradiating a place a meter away. You're really irradiating whatever you're studying.
So even first trimester, you wouldn't be concerned with that?
Well, nowadays, they don't even, I don't know if you guys are aware of this, they've stopped.
It's been a while for X-rays.
They don't shield anymore.
Oh, really?
Shielding is now stopped
while.
because they found that some of the shields cause a higher exposure, more scatter. So there's even discussion about whether or not shielding should be done. But
the irony behind that, right?
Weird, but the part I want us to focus on is that there's one energy. You're going to expose whatever you're trying to study, a chest, a liver, whatever you're studying. And that's the area that's exposed to the energy, and that's the area that will be exposed to the predominant risks, if any, that's associated with that energy. Same thing with ultrasound. If I want to ultrasound your liver, I take an energy source, an ultrasound transducer, and I shine it at your liver. I don't shine it at your ankle. I shine it at whatever I'm trying to study. If there are any risks associated with that energy, it would be that liver that you're studying that's exposed to those risks. These are so self-evident that we don't even think about it. But then all of a sudden they come out with MRI. And it's actually true that for the first time in all of diagnostic radiology, in our entire specialty, for the first time, it just doesn't work that way anymore. In order to generate an image with MRI, I don't take an energy source and shine it at my patient. I take 3 different energy sources. And in fact, if you don't have these 3 different energy sources, you're not going to get an MR image. I have to use 3 different energy sources, which technically will break down to 4. And I shine those at my patient. To make matters worse, where I shine them is not so self-evident. You may be studying the chest, and for some of those energies, you may be exposing the chest. For others of these energies, you may be exposing the head or the pelvis to maximum exposure, even though you're studying the chest. Similarly, what are the risks? The risks differ for each of these energies. And where those risks maximize will be dependent upon where do the energies maximize. And those locations where the energies maximize are not at all intuitive. So there's a lot in magnetic resonance when it comes to safety that isn't self-evident. It isn't so clear that anyone would understand it. And that's why I think the whole field of MR safety was actually born.